All right, looks like we are all live. All right, everybody, welcome to session 2 of our summer series for parents on Generation Z, sponsored by Jacob's Ladder Therapies. For those of you who don't know, Jacob's Ladder Therapies provides individual, family, and couples therapy to teens, tweens, young adults, parents, and recently even veterans suffering with anxiety, depression, mood, and personality disorders. Also family issues, including marital distress, communication problems, separation, divorce, life transitions, and also substance use. Our services are delivered via telehealth by licensed mental health professionals. As we are a diverse group of clinicians, we are able to actually deliver services in English, Spanish, Mandarin, and Taiwanese. You can view all of our clinicians and their bios on our website, www.jacobsladdertherapies.com, which I will post in the comment section. We are also very passionate about providing free, informative sessions to the community. Today we have a special treat in being able to bring you an expert clinician in both mental health treatment and substance abuse. Ricky Adams-Townsend has been working in the behavioral health field for the past 9 years. I'm gonna met some people. Okay. Ricky Adams-Townsend has been working in the behavioral health field for the past 9 years, helping children, teens, young adults, and their families address problems related to mental and behavioral health issues, along with substance abuse. Ricky has training in cognitive behavioral, dialectical behavioral therapies, and the Kasdan parent management training. Ricky views all three modalities as a way to cultivate greater emotional intelligence and thereby giving more fulfilling lives and creating a life worth living. Ricky's currently working primarily with adults in a dual diagnosis program, which supports individuals struggling with both mental health and substance abuse issues at the same time. Here he has seen the ravages of substance and alcohol abuse that it can have on one's quality of life, such as deteriorating mental health, depleting social circles, and reduced value-driven activities. In this work, Ricky is passionate about supporting individuals with discovering their values, developing science-backed coping skills while providing them with information driven by science so they can make informed decisions about how to continue their recovery and live a life worth living. I have had the pleasure of working with Ricky with substance abuse teens who suffer from substance use in an intensive outpatient program, and I have to say he is absolutely wonderful with teens and understanding the complex needs of teens who have substance use. So I'm delighted that he's here with us to share his knowledge. I want to say as a reminder, this session is strictly informative and should not take the place of any therapeutic services by a licensed professional. If you or your family member is experiencing a medical or psychiatric emergency, please call 911 or go to your nearest emergency room. If you feel like your family member could benefit from therapeutic services, you can contact us right away. We provide free assessments daily to help determine the right level of care, even if it's not with us. And I will put the link to self-schedule an assessment in the comment section. Today's session will discuss substance use amongst Generation Z, or our teens, our tweens, teens, and young adults. We are delighted to have an audience of parents and caregivers via Zoom, Facebook Live, and also YouTube Live. So post any comments and questions in the comment section, and we'll address those at the end of the session. If you miss any parts of this or want a recap, you can view it on our Jacob's Ladder Facebook page or on our YouTube channel. And I will post those links in the comment section as well. For access to our clinicians post-session, please consider joining Coffee Grind, which is our private Facebook group for parents and caregivers. All attendees of this session or any of the sessions get a free lifetime membership with code Summer Series, and I'll post that as well. So without further ado, please welcome Ricky Adams-Townsend, and I will let him take it away.
All righty. Well, thank you very much for that introduction to me.
Sorry, wait, hold on. You're muted. Okay, sorry about that. Yeah.
All right. Should I start over?
Yes.
All right. Well, once again, thanks to Mitra for the introduction and for inviting me into being a part of this summer series that Gen Zers that you're promoting. It's something I'm excited about, talking about substance use and mental health. I've been doing this work for a little bit of time. There's a treasure trove of information, absolutely. And I'm going to endeavor to get through most of it today. A lot of it's pretty dense and heavy. My ideas is to share it with you and then comment on it a bit more. So what do I have a goal? My goal is to provide you with the information about the ubiquitous nature, the reinforcers of drugs and alcohol in our culture. What factors likely contribute to teen use, the substances that teens are using the most, and what to be on the lookout for, and wondering whether or not your son, your child is using. And lastly, the different options that you might consider if you find yourself in need of addressing these issues, such as substance use with your teen. So let me open up, let me share my screen with you here. I don't know if I can share it to Mitra.
Oh, I'm sorry. That might be my fault. There you go.
There we go. Okay, perfect. I was practicing and I forgot to start at the beginning. All right, here we go. So teens and drugs, what are they using and how do we know if my teen has a problem? So just to give some full disclosures here, a lot of the data that I'm going to be sharing with you today was taken from online resources, CDC in particular, other journal articles, Psychiatric Times, drugabuse.org. So it's none of my actual data. I will share my experiences along the way in order to elucidate some of the statistics that I'll be sharing with you throughout the slides. I hope it will be informative and helpful. And from there, let's get started. So the statistics, why should we care, right? Let me give one other disclosure before we dive into this, because this may kind of sound like, you know, I'm on a war path, or the data may even kind of speak to that. But in actuality, I don't have a strong feeling towards whether or not an individual uses alcohol or substances. At the end of the day, though, it's for them to decide. So this information is really meant to be able to make more informed decisions for the teen, for the parent, for the family as a whole, right? And understanding what are some of the risks. And I think by looking at these statistics, it's not meant to say, teen, you're bad, you're antisocial, you're this or that. It's like really trying to understand the risks and how to mitigate them, right? So high school teens that drive and drink is about I can't read all this, I apologize. 2.4 million times per month. So this is pervasive, and it's really concerning because this can lead to what the next point says: 1 in 5 deaths. So about 20% of teens that have been consuming alcohol are dying in car crashes. So in terms of talking, and I'll be saying this throughout the slides, in terms of talking about early interventions, having these conversations up front, how to mitigate the risk is essential. And actually the data speaks to that. Early interventions, early conversations of speaking about these subjects that inherently kind of come with some emotional baggage, right? That the teens feels uncomfortable with, that the parents may feel a bit concerned with, and that's showing up more so, makes having these type of conversations maybe less likely or more volatile. So this kind of understanding what up front is coming into play here. So teen drivers are 3 times more likely to experience fatal car crashes as compared to drivers with more experience. And drinking alcohol can cause kids to get her to go to the emergency room, 188,000 per year, right? And I think what this speaks to is kind of impulsivity, the risk-taking nature of being a young person. And again, not that he or she is a bad person, but they're learning about the world. And they actually enter, these decision-making issues with a deficit. So what's absolutely known from a neurophysiological perspective is our prefrontal cortex is not fully developed, right? It doesn't mean we can't make good decisions as young people, but due to this impaired prefrontal cortex, which is used for executive functioning, impulse control, problem solving, it's not functioning as well as an adult with an adult brain does. And so it kind of speaks to, I think, this data of death, car accidents due to alcohol. All right. Again, drinking can lead to poor decisions, engaging in risky behaviors, such as entering a car after drinking, having unprotected sex, aggressive, violent behavior. It's very clear. Data is indisputable about increased violence and aggression in connection with alcohol consumption. Underage youth who drink are more likely to carry out or be victims of physical and sexual assault. Drinking may cause youth to have trouble in school, right? And that added stressor could actually contribute to more drinking as well. Then research has shown that people who start drinking before the age of 15 are 4 times more likely to experience dependency later on in life. So clearly we have a lot of data that says, okay, we need to get in front of teens and start having these conversations sooner rather than later, right? Explaining to them the risk, having conversations with them as opposed to dictating to them or having conversations at them. We want to help them remain engaged and be a participant in the conversations, right? So kind of holding that perspective up front so that you can cultivate it over time. Because clearly as a parent, seeing the dangers, they're going to be entering these conversations largely with more of an emotional mind. So knowing that up front, parents, caregivers can do their own kind of coping strategies so that they can better able facilitate these conversations and address these issues and help the teens move forward in life safely, meaningfully, and productively. All right, so let's take a look at why my teen is using and the factors that can contribute to teen use. So ease of access. This is a significant one. So I would encourage each and every one of you that are online today watching this talk is, take a catalog, go through your liquor cabinet, your refrigerator, your medicine cabinet, and see what alcohol and drugs are accessible. we're not trying to create a sterile environment, but really to understand the ease of access, especially earlier access for teens. This is one of those avenues. So if it is there, and you feel strongly about not putting it under, I guess, a more secured environment, then having those conversations. And then how would you also monitor it, right? So this is a very powerful statistic that I wanted to show. So teens get drugs or alcohol from their friends, and about 20% of it are getting it from the school site itself. So kind of understanding where your teen is going and who they're going to be obtaining these substances from is important information, because then you can start having these conversations again early on. There's no guarantees, but we absolutely can start to problem solve and decrease the likelihood, right, of teens accessing or experimenting with certain substances. So the perspective that substance use is safe, this is a huge one. I hear this one a lot, and I'm sure some of you have as well, that it's safe and it's normal experience is what drives teens into thinking that, hey, this is their fun years, this is their teenage years. I've heard this many, many times in my 7 years of working primarily with adolescents, is because this is their young time, they're able, or they should be experimenting more and having more fun. And of course, we want them to do that. Of course, we want them to take risks. We just want it to be measured and to be mindful in terms of when they start to consider what they might consume or experiment with. Substance and alcohol use provides a common ground for interacting with like-minded peers and an avenue to instantly bond with peers. So just imagine a young person that may be experiencing anxiety, or that's moved into a neighborhood in a school where he doesn't know any people. He or she doesn't know anyone. So this could instantly allow the young person to create that connection with their peers. And here's the interesting thing, right? We talk about, or I often talk about, like, reinforcers, right? And alcohol or substance uses is like this double edge. It both positively and negatively reinforces that behavior. So positively, it makes them more verbose, more kind of maybe the life of the party, right? And negatively, it reduces their experiences of anxiety, kind of what I'm experiencing right now, but I think it's leveling out. Hopefully by the end of this, I'll be there, right? So you got two factors of reinforcers that are contributing to a teen youth, right? Or a teen using. But really, again, just trying to understand this. So then when we do sit down and have conversations, we're able to empathize a bit more and understand their reasons for choosing to use substances. Teen and their peers may speak about substances, specifically cannabis, as being natural. And again, I hear this one so often. It was used by indigenous people in a natural way to manage physical and psychological issues. And in truth, you go to a psychiatrist, you're gonna be given a psychoactive medication, right? And that's what marijuana is, or pot. That's what alcohol is, any of the other drugs. But the one big difference is you have a set of eyes. That's a professional that's looking for abuse potentials, that's looking for negative side effects, whereas the individual that may be using medication to self-medicate is not, right? And it can quickly turn into a slippery slope, which we'll talk a little more later. Here we are, self-medicating. So teens turn to substances and alcohols as a strategy to cope and escape distressing experiences and emotions such as depression, anxiety, frustration, anger, and self-esteem. In working with adults primarily, I've heard this a lot. Some with teens. I didn't do a lot of work, but I did some work with teens and their substance use. But absolutely, story after story after story, hundreds, and that's not an exaggeration, kind of give their time lapse of when they use, oftentimes in their early teens, and and in particular to address the anxiety, the depression that they were experiencing. So they went into it knowing that they were self-medicating. Another big one, and this one really has me fascinated. So boredom. I don't know if you've heard this for yourselves, but teens will often cite boredom for reasons of use. And this one particular article by Waybright, 2019, noted that boredom is associated with sensation seeking and depression, which is on the rise for US teens. And here's a very important fact. At the same time, digital media, which really covers everything we're accessing today, YouTube, Facebook, gaming, Twitter, TikTok, all these have an impact on a teen's brain, similar to those of drugs. So let's think about this. The average time that a teen may be accessing electronics is about 7 hours a day, where they're getting a dopamine rush, for example. They put that item down, they take a break from it, and they feel kind of anhedonic. They're not getting that dopamine push. So we're walking around, feeling bored. Now, how do I resolve this, right? How do I escape this discomfort? And thus the possibilities of turning towards some sort of substance, alcohol, marijuana. The jury's still out on it, but definitely the pieces are lined up for that possibility. And again, something to consider. And I think kind of that natural instinction that many parents and caregivers have about helping teens have more of a balanced life in terms of electronics, in terms of going outside, that's warranted. And I would encourage you all to absolutely continue to find ways of helping the teen do that as well. We don't want it to be contentious, because then they're not going to buy into it. But at the end of the day, it's absolutely the healthier thing to do, is getting this balance. Another factor, and this kind of puts the light on all of us as adults, is teens observe parents and adults consume substances such as alcohol, cigarettes, and sometimes other drugs, marijuana, cocaine, prescribed medication that we talked about earlier, right? So how are you using it? And in what context? Imagine coming home and you're using it after a long day, and you mention that, like, man, I had a tough day at work, and you're going to the refrigerator or your liquor cabinet to have a drink. That little data bit gets stored away in the teen. And observational learning, especially for young folks, is a huge factor in terms of what a youth will do themselves at some point. Media, film and music sensationalizes and glamorizes drugs and alcohol. And until I started this work with dual diagnosis and being exposed to it, I never really caught as much as I do on television and media. And it's quite powerful and striking, where you will see, even in sitcoms, there's a beer being popped, or someone coming home from a long day at work or after an argument, and they're immediately turning to alcohol. And imagine a young person observing that. So look at this statistic here. 45% of teens agreeing with the statement. The music that they listen to makes marijuana seem cool. So why wouldn't they want to use, right? Movies and TV shows, again, makes it seem like drugs are the okay thing to do, right? So this is the information that's feeding their view of the world and whether or not they will use. And as a parent or caregiver, that's what you have to contend with. They're getting a large amount of information, actually, right, from one source, and some information from their parent. And who do you think is going to win, right? It's an uphill struggle for sure. So what type of substances do teens use? So first and foremost, how this slideshow started is alcohol. Alcohol is by far the most common substance use amongst teens and adults. The percentage of high schoolers using ranges from 19 to 41%. And this span is really across from 9th to 12th graders. And there is data that speaks to consuming alcohol as early as 13 and younger. So it is occurring, obviously, but it absolutely is ramping up as we enter the high school years. Kind of what we spoke about, or what I spoke to a little bit earlier, is 6% of teens who have consumed alcohol end up driving. And 14% of those teens get into a car with a peer who is driving. So think about that, and think about the increased likelihood of death when these factors are coming together, and all the reason to have some real serious conversation with peers or with your children about, you know, a zero tolerance. You do not get into a car. You call me, we have Uber, whatever it is, whatever the family feels most comfortable with. Just kind of a personal example, I do absolutely recall friends of mine that were adamant they would not get into a car or they would not drink if he was driving. And they had a really cool kind of inner strategies amongst their friends. Is if one was going to drive, then the other would consume alcohol, and they kind of had this back and forth where they kind of shared that responsibility of driving and getting the rest of their friends home safely. So again, I'm not condoning it, but these are kind of the strategies that I've heard along the way. And they're potentially may be realistic depending on the context. So common signs of alcohol use. So, you know, deterioration in school performance, withdrawing from extracurricular activities, mood changes absolutely can start to present themselves, rebellion against family rules, you know, friend changes and this reluctance to introduce friends to family, a nothing matters attitude. So really what we're talking about is really a significant departure. And this is going to be a common theme across all the substances, right, that we're going to be discussing today. A significant departure of that youth's behavior, right? It doesn't mean it's absolute, but it absolutely means to start having a conversation, sitting down, getting in front of them, and letting the individual know that you're concerned and worried, coming from that perspective, rather than, I think what I like to say, rather than be accusatory, be inquisitory, right? So ask questions so that you enlist their willingness to want to communicate with you. All right, moving on. Cannabis. Cannabis is absolutely, I guess it's at its high point, right, in terms of its consumption. And partly what's contributing to this is the legalization pretty much across the US, right? The range of use is 30 to 26%, and actually cannabis use outweighs, or there's greater prevalence than that of smoking. So some of the names of cannabis are marijuana, weed, pot, spliffs, you know, certain strains, Sinsemilla, skunk. There's also the synthetic, man-made marijuana, and it has similar psychoactive properties, but it's absolutely much dangerous. And this is largely due to its potency. It's not regulated. The teen may take much more, or take maybe even the same amount it would take from naturally grown cannabis, and that might put it into a toxic level for him or her and end up going to the ER. Evidence suggests a correlation between cannabis and the consumption of psychiatric conditions. And I read about this actually a couple years ago, and this is really powerful, because right about the time that I read this article in the Psychiatric Times about the increased likelihood of psychosis, which means hearing things or seeing things, due to the consumption of cannabis. And so what we found, just to kind of give you this broad stroke, is the THC level, which is the active ingredient in cannabis, has changed significantly. So if we look at it back in like the early 90s, it was like maybe about 4%. Early 20s or 2000s, and from the 10 to low teens. Then 2010, high teens to 20s. And today, it can be as high as 80 or 90% because I forgot what the term is. They reduce it down to such an extent. And at that high level, it's often being consumed through vaping. So this is what the study found. The last bullet point here is there's this dose rate, meaning the higher potency of the THC and frequency, the more often you're smoking it, you increase the likelihood of experiencing psychosis, about 7 times more likely. So as I mentioned just a moment ago, when I came upon this article, and I kid you not, maybe a week or two, I started seeing a young adult in his early 20s. And he was significantly disturbed about experiencing psychosis, hearing things. And it was so traumatic to him. Once I shared this article with him, he was going to discontinue his use. And he'd been a fairly long time use, 6 or 7 years for someone in early 20s. So he started in his mid-teens. So again, something that we would want to introduce to teens and say, look, here's some of the risk factors, right? Now, on a positive note, if there is such a thing, is once you discontinue, the psychosis resolves. But here's another thing to also keep in mind. It's not an absolute. In psychology, how we address these uncertainties and why mental health evolves to begin with, we have different theories for it. One of them is the stress diathesis theory, meaning we go through life when we experience a significant event that triggers something in our brain to start presenting with depression, anxiety, psychosis, right? So potentially using high potency cannabis can be that stress factor. So there's no guarantee that once the individual discontinues its use, that the psychosis resolves. But there is a lot more data that does speak to that. It does. I'm just not unsure about if it's 100%. So common signs of marijuana use. Acting very silly and out of character for no reason. Using words and phrases like sparking up, 420. I don't know if you're all aware of this. This was a new thing for me at least 5 years ago or more. And hearing teens in particular speak about this, right? 420 is the month and day for cannabis. Dabbing and shatter. Other phrases. Having an increased irritability, losing interest in motivation. There's this, I think, amotivational and excessive use, high THC use really impairs one's motivation to engage in activities that they previously enjoyed. And another important factor is cannabis, and we don't really kind of think of it this way, is it has the same neurophysiological impact that other powerful drugs have. So it absolutely increases our dopamine release in our brain and has this ability to change what we call the hedonic set point, right? That level where we experience pleasure, right? From, say, for example, taking a walk out in Mother Nature and enjoying that, playing video games, enjoying that, eating your favorite dessert and enjoying that. And if you can imagine that set point, that natural set point, just to kind of illustrate this for a moment, goes up to your knees. But due to cannabis or other substances, that set point gets raised due to the influx. It's almost like a flash flood of sort of dopamine in your brain, and it has to adjust to that. So it raises your hedonic set point, right? Say up to your neck. So the problem here is when you start to engage in those other activities that you previously got pleasure from, you're no longer enjoying it because the spike of dopamine can't even reach halfway up. It's going to your knees. Remember that previous level. And it's never going to be able to reach that level that drugs or alcohol induces. The nice thing, though, with this whole thing is it can reset, but it's going to require, the systemic abstaining from drugs and alcohol, and it'll slowly decrease over time. Other signs, it's just the classic ones: red eyes, urges to eat, having the munchies, was often said, stealing money, or not having money to be accounted for. And this is by far, in terms of working with adults, we have this absolute zero tolerance, not zero tolerance, but in order to enroll or participate in our program, it's an abstinence-based only program. And it's 8 weeks long in general. And what a lot of these individuals share throughout the course is having this excess cash that they didn't have before. So they were spending a fair amount of money to maintain this high. All right, so what we were talking about earlier at the beginning of the slides is prescription medication. This one is actually quite prevalent, so it's showing up now amongst the slides. So the percentage of teens who have ever used prescription drugs, and this is non-prescribed, this is the ones that they're finding in your own medicine cabinet, or maybe getting from their peers out of their own medicine cabinet, or maybe due to medication left over from surgery that they may have had to manage pain, for example. So that percentage is around 11% to 17%. So what are some of these potential prescription medications? Ritalin and Adderall. I think there's an additional one, Concerta, used to address support individuals or medication management for individuals with ADHD, attention deficit hyperactivity disorder. They may, if an individual has that diagnosis and is being prescribed those medication, he may be taking them to school and selling them. He may discontinue use and share them with his friends, because it's well known both in high school environments and college environments to use this medication, because it helps increase one's ability to study. And on a cautionary note, because it is being used outside of prescription, no one's monitoring it, and it can become an addictive drug, to where now this person has to access it through more and more illegal means. So what does this look like? A sense of being on the edge, anxious, nervousness, this hyperkinetic activity. They might be grinding their teeth, inability to relax or sleep, increase in body temperature, chest pain, irregular heartbeat, dry mouth and headaches, difficulty falling asleep, right? Extreme weight loss. Unfortunately, a side effect in general, and one that's managed again when a psychiatrist is prescribing this to you that have a diagnosis of ADHD, is how to manage that weight loss. That is one of the side effects of it. Confusion, delirium, paranoia, psychosis, suicidal thinking, right? All additional symptoms or negative side effects that one may experience from using these medications. That again might be residing in one's home. Another common prescription drug is pain relievers. I know multiple times from different surgeries that I had, that my wife had, we were prescribed some pretty powerful pain medication. And for the surgeries that I had, I absolutely loved having it, because I failed to take it as prescribed. And I was in such excruciating pain. I never made that mistake again. However, the minute I was healed, I knew the high potency and addictive potential of these medications. I discontinued use as quickly as possible. So what are some of those? Oxycodone, codeine, morphine, Vicodin, hydrocodone. The doctors, they've gotten a lot better at this, because there's been an epidemic of using pain relievers and having excess amounts, and then them being abused. Why do people want to use them? Why do teens want to use them? Because it helps them feel relaxed, happy, or high. It can cause drowsiness, and that could be a motivation for some, right, if they're having difficulty sleeping. A mental fog, nausea, constipation, a common side effect, dizziness, and respiratory depression, which is a significant negative side effect. All right, how are we doing on time? We got time.
Have about 5-10 minutes, and then we can take some questions.
Oh my goodness. Okay. So this is what I'm going to do. I'm going to fast forward from, because we have cocaine, methamphetamines, and these are lower prevalence rate of drugs in the teen scene. They are there, but the overarching message here is really to have these conversations. And I think kind of the last data in the end, oh, actually, here's an important one. And this one I'd like to just kind of share with you all. Inhalants are absolutely prevalent amongst our teens, but more prevalent amongst our young teens, right? So as you can see, these numbers are actually transposed. If you saw all the earlier slides, it was low number on the left, high, and I did this purposely. So again, this data is supposed to show the range across 9th to 12th graders, right? But absolutely earlier, younger children, adolescents are using it as well. So one of the ideas about why this is more prevalent in younger populations is likely due to the availability, the accessibility of glues, of paints, right? And then potentially seeing it on YouTube or a movie or hearing it from a friend in terms of this high feeling that they can get from it. So what are some of the common signs that you know, that a parent may see or a caregiver, right? So belligerence, apathy, and significant impaired judgment and impaired functioning, nausea, vomiting. It's really having this significant negative impact on that young person's physiology, depending on the dose effect, and really damaging the brain as well. High doses can cause confusion, delirium, dizziness, drowsiness, slurred speech. So a lot of the same now symptoms that you may see from the other, from alcohol and potentially marijuana. So we'll bypass these. Ecstasy is, I think it was a popular drug earlier on, but it's still one that shows up. The percentage is actually quite low, and I was actually surprised by this, 2.5 to 6%. I was surprised because it has such a powerful impact on teens in terms of, it's called the happy pill or the Playboy pill or the hug pill. It really lowers one's inhibition and therefore impair their decisions in terms of maybe having sex when they're not planning to have sex, or accessing additional drugs when that's not on their radar. All right, so let's get to, I guess, how. All right, so how do I know if my teen's experimenting versus has a drug issue, right? So three kind of the big terms that are used in addiction medicine is abuse, and really what this is talking about is using a substance to where it's negatively impacting your life, but it's not a pattern. It like shows up from time to time. Maybe I drank too much on a Saturday night, and I wake up and my Sunday's just totally demolished. I don't get out and mow the lawn, take out the garbage, or any of that. And that's what we'd consider abuse. For a teen, it would maybe look like not going to a practice or not completing their work, but it's not a pervasive pattern in their life. Dependence is when the individual is using the substance, needs to use more of it, worries about not having its availability. And it starts to now trickle towards this, it's like almost like a razor's edge that the person's approaching between dependence and addiction. But there is a fine distinction between the two. So where dependence may have some withdrawal symptoms, and as well addiction, the behavioral component in addiction is what's significantly different. In addiction, the individual is driven to get that drug regardless of the negative impacts it's been having on their life. Whereas dependence and abuse, that insight, that ability to make healthier decisions is more enabled. And in fact, addiction is thought of as a disease of the decision-making process. Right? So again, in the service of time, I had like 3 scenarios just to kind of illustrate this, but what I want to get to, because we're limited on time, is that correct?
I think people might want to hear maybe a scenario. So why don't we do a scenario?
Love it. Okay, so let me, all right, well, let's go to, I guess, they're pretty straightforward, but I just kind of liked how I may illustrate it. So Travis was recovering from a shoulder injury that required surgery. Post-surgery, Travis was prescribed oxycodone for pain management. It had been nearly a year, and Travis had to take increasingly higher doses for relief. However, he had healed well from surgery. Travis says he can't play baseball without the medication. Additionally, his grades have dropped dramatically. He's not attending classes. He's avoiding friends and family members. This week, Travis's baseball coach called him and said, "Hey, you haven't been showing up for practice all week." So despite all these negative consequences, Travis doesn't seem to care about his drug use and continues to do so. So of these 3, which one do we believe that's speaking to? The experimentation, the dependence, or the addiction? And
Anybody can unmute themselves and see if anybody on.
Can we see the other 2 scenarios? I wasn't able to read fully those other 2.
Oh yes, I just focused on one.
Oh, okay.
So it was addiction, right? So really that defining marker for addiction is continued use, regardless of the negative impact the individuals it has on its, that the medication drugs have on that individual's life. So they lost a job, they've got kicked out of school, they're losing their apartment, they're unable to pay, like any and all that. And they still continue to use the drugs. The fascinating thing about this, just to share real quickly, is so in general, if you're talking about like the hierarchy of needs in terms of our brain, number 1, prior to introducing drugs and alcohol, is eating, right? We need food to eat. The second one of our hierarchy of need is survival. Right? We will do whatever it takes to survive. So if we're aggressed upon, we're gonna fight to survive. And then the last one, because we want to continue our species on this earth, is procreate. However, this level of addiction, what it does is it trumps all those, and it goes in the number 1 spot. And eating becomes number 2, survival becomes number 3, and procreation becomes number 4. And this absolutely is illustrated time and time again in terms of an individual that has an addiction. They will forego eating. They will forego their own physical health issues, right? That's going to put them in the hospital and threaten their own life. And they will totally forego having a meaningful relationship and consider procreation. That's not even registering on their mind. First and foremost, it's just the drugs. So it's really fascinating to learn that and kind of understand why it's so powerful for that individual to use, and why it's so difficult to get them to discontinue use. So how can I help my team, right? I think at the end of the day, this is what it's about. So as I mentioned earlier, the best intervention is early intervention, right? Having these conversations up front, building the young person's ability to do well in school, ability to manage mental health, supporting them in developing healthy friendship. All those factors act as protective factors in terms of them turning to drugs and alcohol. So they're less likely to do that. Whereas if the young person is having challenges in school academically, is having challenges socially, is having challenges with mental health, those are the risk factors that increase the likelihood of a young person turning to drugs and alcohol. So any way that we can help them address those issues early on, we're increasing the likelihood of them not turning towards that. So those are the preventative strategies. What can a parent do? Parent or caregiver, becoming informed. There's a wealth of information out there, right? Understanding the, kind of the barriers that that you're going to be confronted with in terms of maybe your own emotional reactions to a teen using and putting themselves in a very dangerous situation. And albeit that's very valid to approach the teen from that perspective, it actually puts you at a deficit because their ears are going to shut down. They're not going to want to listen to mom or dad or auntie or uncle or whomever it is in front of them. So it's really this position of understanding and empathy. And all the same, always holding them accountable, right? It's just how we do it. So communicating regularly, age appropriately to your child or teen about drugs and alcohol and smoking. Improving family relationships and friendships, right? Again, those are the protective factors. Reinforcing healthy habits, right? So you see a teen choosing not to hang out with a particular peer, or choosing to celebrate in a healthy way without substances. Pointing that out, the more we can speak to those behaviors we like to see, increase the likelihood of the teen using them going forward. So introducing them to other interests. What are they going to feel passionate about that gives them meaning and purpose in life? So they may need help. And by having those new interests, it decreases the likelihood of them turning towards their substances. And of course, ensuring the teen has a clear understanding of the family rules and expectations regarding drugs, alcohol, and smoking. So although we're approaching them with this understanding and empathetic response in terms of why they may choose to use, right? To feel a greater ability to connect with their friends, to be in that social circle, to manage the significant anxiety or depression they may be experiencing. While we can understand them wanting to reduce that, we will also set the expectation that it's not going to be through drugs and alcohol. So again, depending on the age, maybe you'd want to consider what drinking responsibly would look like, right? Is that an option for you as a family? It's for some, just in terms of absolutely in this talk, yes, there is a legal age, it's 21, but realistically, as the data shows, teens are using. So that we want to potentially consider a harm reduction model and say, well, I can't really control, I can't be in the backseat of your car 24/7. So how can we address this? How can we address mom and dad's concerns? We want you to be able to make your choices, right? So this harm reduction model may be something a family would want to consider, right? Knowing your teen's friends and their parents can help in both families coming together and impressing upon both sets of teens making healthier choices, safer choices, right? Modeling as adults in front of teens, as I mentioned earlier, observational learning. Teens, younger children are watching every behavior, every action we do, and we'll consider doing that behavior in the future at some point. So modeling good consumption can speak volumes or lay the foundation for them of using. So maybe I wouldn't be drinking alcohol at dinner, knowing that I'm going to be driving the car with my family. Maybe I wouldn't be drinking to excess to where I'm belligerent or falling off the seat or being over boisterous, because I don't want to demonstrate that for my child. Again, the reinforcing it is a paramount strategy in terms of positively impacting a young person's behavior. So looking for those opportunities as often as we can, and reinforcing those behaviors we want to see more of, right? What I like to say to parents is, how do you get the biggest bang for your verbal dollar, right? Reinforce, be effusive, be specific, say it often, say it with touch, right? As mentioned earlier in my bio, Kasdan is a phenomenal psychologist, has done tons of research with adolescents and teens, and in particular, oppositional defiant and conduct disorder. And he found that, in improving parenting strategies had the most positive impact addressing these significant behavioral issues with teens. And this kind of more effective reinforcing strategy can go a long ways. And then in the end, what we always want to do, is hold the teen accountable for the behavior. So whatever, ideally having something set up front, right? If you break this household rule, this is the result, and then following through and being consistent with that. In the program that we have, we do random testing. We do behavior chain analysis. We do self-disclosure. All these strategies of accountability help the individual want to maintain sobriety, and also helps them also practice being truthful, because oftentimes when an individual is abusing substances, not speaking the truth is more prevalent. Lastly, I came upon this actually more recently, and this is a relatively new model that can be used for parents in particular, and I don't know about professionals in the work of addiction medicine, but I absolutely think it could be, because it has the core components of how to support an individual that may have a substance abuse issue, or not, right? Either way, what we're talking about here is having these conversations up front, this validating of emotions, right? Not the behavior. This understanding, I like this red light, green light they use to kind of, what are you going to look out for when you sit down with the young person and have a conversation about using. And at the end of the day, we want to have this be a two-way street. We want the individual to be able to, the young person, to be invested in the conversation that we're having with them, so that they are listening and will consider our words of concern, and as well participate in problem solving, right? And we do that because it's going to increase the likelihood of them following through. So this red light, green light, like if we're starting to notice either ourselves becoming triggered or the teen becoming triggered, how do we address that earlier on? Maybe we take a break and then come back and address the conversation a short time later is a very effective strategy, actually. You attenuate the emotions, you increase the likelihood of accessing your prefrontal cortex. Your emotions ramp up, cortisol is released, and it effectively shuts down your executive function and problem solving and the ability to regulate emotions. So this idea of being almost hypersensitive, for lack of a better word, of really managing the emotions while we're having these potentially difficult conversations. And again, having to be collaborative. We really we don't want to speak at the teen. We want to speak with them. We want it to be a two-way street. This idea of understanding the reinforcers, right? So why are they using, right? What's the function of that substance? And if it's to manage social anxiety, if it's to get rid of depression, then ideally having that information up front, then we're able to, as caregivers, parents, remain in that conversation with them without getting emotional ourselves. Again, especially if they maybe wrecked the car or did something that it's going to cost money that parents have to pick up the tab because they're responsible, right? Again, not that we don't have emotions to it, but just really trying to kind of understand the context of why the individual used, empathizing with that so that they don't feel we're not understanding their own needs, and then how maybe we can better address those needs. Again, part of this craft strategy is understanding that ambivalence, right, of the teen wanting to change, right? Because if we're saying, hey, you got to give this up, well, what are you going to give me in replace? If I'm using it to connect with my peers because I have social anxiety, or if I'm using it to get rid of anxiety or depression that I experience on a day-to-day basis, right? So they might be all in because they really love mom and dad or caregivers, and they want to please them, and they also maybe even understand the negative impact of drugs and alcohol. And at the same time, they're grappling with giving it up because what else do they have, right? So understanding that ambivalence and not becoming frustrated with it, right? It is a process. So one of the things that gets brought up is enabling, right? This I see more of. Actually, I think I don't have any personal examples in terms of enabling for teens, but absolutely I have some examples of adults of where family members, young adults actually, and husbands or wives will enable their loved one of consuming. So how do they do that? So for example, let's say, I consumed too much alcohol one night and I was supposed to meet with my friends the next morning for a bike ride. And I totally flake on them. In fact, I don't even answer the phone. My wife answers the phone and says, oh, guys, sorry, Tom. Ricky can't make it today because he came down with the flu. That would be an example of enabling, right? And helping me continue to not address these issues, right? That can, maybe it's gone from abuse now to dependence, and then potentially this addiction. So enabling is this pattern of behavior that occurs over time and actually contributes to the individual using more rather than less, because I'm not experiencing any of the natural negative consequences that may be associated with it due to my parent or loved one saving me from that. So it's something that we want to be aware of. Now with that, it doesn't mean you can't be in there and support your loved one, right? Or your child. You're just not making excuses for their use or saving them from those natural consequences that they may experience. And that can be a fine line to straddle for a parent. So at the end of the day, it's going to be a very individual family choice in terms of where they might be approaching this enabling. Maybe they don't want their teen to stay in jail overnight, because absolutely, I think it's mandatory if you're pulled over and you're under the influence that you're going to be spending the night in jail, if not a couple of nights. And yet family is going to say, absolutely, that's not going to happen. I'm going to bail you out as soon as I can, right? So again, it may not be the worst decision. It's a very individual decision for the family. And at the end of the day, in terms of using this craft method or not, or just being there and trying to support the individual as best you can, how do you also take care of yourself in parallel? So this that old adage of, hey, when you're in an airplane and that yellow mask drops from the ceiling, put it on yourself, right? So that you can then help others. And the same is true here, right? If your son or daughter, teen, is experiencing mental health, substance use issues, we absolutely want the caregiver, the parent, to be able to stay in the game, so to speak, right? And by doing so, you're going to be caring for your needs in parallel as you support the individual. I think that's it.
All right, Ricky. There are some questions, and I have something that I want to show everyone one. So while I am unsharing your screen and share my screen, there was something that came up about Skittles parties. And I don't know if you're familiar, but maybe you can speak a little bit to what are Skittles parties, so that these parents are familiar what that means if they are ever approached about their teen going to a Skittles party.
You got me. No, I absolutely saw it, that lingo, that slang, and I don't know if it might even be in one of the slides above to say what medicate or what drug that is. It's absolutely a slang for a drug. I just offhand can't recall what it is. So it's not Skittles, but it is taking illicit.
Definitely not Skittles.
Right.
What they refer to as a Skittles party is when teens basically raid their parents' cabinets for drugs. So all the drugs that they have in the cabinets, whether it be the drugs that you mentioned, the hydrocodone, the Vicodin, it could be Tylenol, it could be just about anything. And basically they get a little bit of everything, and all the teens bring it together at this party, and they put all the pills in a bucket. And then you just pick your choice. You don't know what it is, you don't know what you're getting, but you just pick one. And these parties are very dangerous because, you know, teens they feel like they're invincible, right? And so it can be very scary because they don't know what they've taken. If they overdose, they can't tell a hospital what they took because they have no idea. It's just a bucket of pills. And it's something that's sort of coming up more and more of these parties. And, you know, we try to tell parents, lock up your medications. Just keep them all on lock because teens will get into it. They can get into it. If they don't get into it, it's possible their friends can get into it and are looking for something, or they, you know, so it can be very disturbing, these new sort of Skittles parties.
Yeah, no, the danger is absolutely there, and probably the highest. Drug interaction, one can potentiate the other, which means increase it, make it even more potent. It can be a central nervous system depressant, and if you add alcohol to that, it can drop the individual's blood pressure so low that they can actually die. So it's, yeah, I would absolutely encourage families to put out the warning flags and communicate that to their child, teen, about the danger of that one in particular.
I'm sharing my screen. Can everybody see that? This website? Ricky, can you see this website, or is it too small? Should I make it bigger?
Yeah, I can see it.
Better? Okay. So one of the things that we do talk to teens about is dressing like an addict. And they always ask, what does that mean, dressing like an addict? And there are brands of clothing that promote specifically drug use, but a lot of it's marijuana use. And a lot of parents don't know what these brands are and what they look like. So Cookies brand is probably one of the biggest brands. So you don't always see, like, this just looks like a Cookies shirt. It doesn't have a marijuana label or anything on it, but this is a marijuana brand shirt. You also have Huff brand. Weed socks are very popular amongst our tweens and teens, and they just look like this. They come in all different colors, and we get teens who wear these all the time. We have, so the Huff brand typically, so if you can see the Huff brand, not necessarily, I mean, you can tell that that's a marijuana leaf, but if you're not really looking for it, you may not. Killer Acid, Kush brand, Thrasher. Thrasher is a skateboard line, but it also promotes drug use. Again, more weed socks. So just being aware, this cookie shirt, again, doesn't at all look like it's a marijuana brand at all, but if your teens are wearing these things, they are promoting marijuana. This right here is a Santa Cruz shirt. So Santa Cruz, all their clothing is not drug, but these are mushrooms. So it's, again, promoting drug use. So I just wanted parents to kind of see what your teens may be wearing that may be promoting drug use. So it doesn't necessarily have to have the weed on it. This one has, oh, I thought these were poppies. These are roses. So I'm not really sure that this is oh no, so you see there's marijuana leaves actually at the bottom here. But basically I just typed in marijuana. I went to this website, and this is a very popular store that is in every mall. And I typed in brands of weed clothing, and this all popped up. So just being aware of that. So I'm gonna stop the sharing of my screen. And then there are some questions for you. So one question was, how do I stop my teen from hanging out with friends who I know use drugs?
Yeah, that's a high road, or a difficult road to travel for sure. You know, teens and their peers are, you know, nearly the most important people in their lives outside of their family. And you know, at times I think that line goes back and forth. You know, the teens are learning about the world, they're experiencing the world in parallel with their peers, so they can quickly align with them and see them as really important. So it's not easy. I don't think there's any one best way, but what I can speak to is, as best you can, reducing the contention and the arguments around it, because that absolutely will not increase the likelihood of them changing. So really trying to understand why they want to continue to hang out with those peers, seeing whether or not you can get them to commit to not using if they are going to hang out with those peers. And then it's a matter of building trust and maybe how to ensure that they're being trustworthy. So maybe they have a different type of curfew. Maybe they're being driven to a friend's house or picked up. It's really being creative at this point, because they're going to really put their heels into the ground if the parent outright comes out and says you cannot hang out with those friends. In terms of the adults that we work with, and we would have the same strategy with teens, is once the individual decides to abstain from drugs and alcohol, let's say due to them abusing it, we absolutely encourage them to stay away from those set of friends until they have enough of the protective factors in place, and ideally develop sober friends. But that's a difficult road to travel, especially nowadays with COVID-19. The ability to make friends is more impaired.
Thank you. Another question is, my teen looks high, but they said that they're not, and I have never caught them using, but I really think that they are using. What do I do?
Again, these are great questions, and they're actually very common questions. And the answer that parents often get, and it's not an easy one to know. So I guess at the end of the day, you knowing your own child and whether or not they're trustworthy, you would weigh in terms of, okay, I am going to believe them or not. if you don't, it's again sitting down and having these conversations. So maybe if you really want to know the truth, then you're going to consider introducing a drug test for them to show that. This can be, again, a very, very contentious something to request, because they're going to say, you don't trust me, and that's going to incite conflict within the family. But at the end of the day, we want to be able to trust each other. So finding ways to get there, it may require a fair amount of conversation. Potentially, you would do that with a third party, like a therapist or some sort of program. If it's not to that level, then it's then sitting down regularly and having those conversations with your teen or young person. So you may, if you're really uncertain, then maybe you don't give them driving privileges until they can demonstrate that, in fact, they are not consuming drugs or alcohol.
That's great. And so for parents who don't know, you can get a drug test, right, Ricky? Like on Amazon. I don't know about like the groceries, I mean like Walgreens or CVS or places like that, but.
Yeah, they're there as well. So you want to be, again, and I can immediately think of a young person that I worked with in not too distant future where this was a significant issue. And that was a strategy that parents used. And even though they used it, didn't guarantee it. So a lot of other, depending on the individuals, how deep they are in abusing, let's say it's cannabis, and they're regular users, they may be adamant about not wanting to give that up for a whole host of reasons. So if they agree to take it, there's also ways of flushing their system, of gaming the system, right? Gaming the test. And one of those is consuming large amounts of water, which basically dilutes the THC level in your bloodstream. So one way around that is ensuring that they don't drink large amounts of water a couple hours before the test. Doesn't mean you can't drink any water, but you really want to limit it. As well, if they were to take the test in the bathroom alone, there's that possibility of them manipulating the test. So for example, where we work, they go into a room where that ability to manipulate the test is nearly zero. The faucets are turned off, the water in the toilet has a blue dye chip thrown in it. They're not frisked, but they're kind of looked over and making sure that they don't have any bottles of water or even fake urine, and that actually gets by from time to time. That's, again, more of an extreme case, but not impossible. I feel kind of, I don't know, not bad, but like we definitely don't want this to be, again, like we're really trying to police the youth, but it absolutely isn't unusual for it to get to that extent either.
And I just want to add, and Ricky, you can kind of chime in on your thoughts. I've dealt with parents who really had questions, and I've told them, it's okay to search their room too, and to see if you are really having struggles. It depends on kind of the comfortability of the parent. And I know that, a lot of parents feel like their room and privacy. However, if this is becoming a safety issue, if you really feel like your teen, especially if your teen is driving, that it's totally okay to search their room. I probably wouldn't do it in front of them. I'd wait till they leave. But searching their room, searching their backpacks, underneath their bed, and looking for drugs and paraphernalia, and being comfortable with confronting them with these items, and letting them know that, your privacy ends where your safety begins. So I don't know if, how you feel about that.
No, I love that point. And I love the idea of maybe waiting. It really, it's kind of going to be this very family, individual point, but it can absolutely look like this power struggle, right? Of a parent going into the young person's room while they're there when they're saying no. So I love the idea of maybe waiting for them to go off to school and searching it and then having this conversation. And again, up front, knowing that if you do find something, that to understand that when you confront the teen, it's going to be an escalation by and large. So how do you minimize that, knowing that they're going to do there? You don't want to bite the hook and escalate it as well, because at the end of the day, the goal is to address the issue, not to become emotional and not address the issue, right? So I think your point was, yeah, very important to me.
Another question was about when a tween, so 11-year-old who's sniffing markers. Is that harmful or not?
Yeah, no, check that out. And I was kind of grappling with this a few years back. I know Crayola came out with those berry, cherry, like markers that have all these delicious smelling flavors. But what are we teaching them to do? So it can be. Those absolutely were not. At least I believe they were not, because that's how they were advertised. But it absolutely leads that young person to think that, oh, I can sniff any of those. And some of them are toxic, right? So for example, Sharpies can be toxic. I'm not really clear on like the toxicity, but the chemicals in there are not meant to be sniffed. So in general, if you see those as a parent or caregiver, I would sway from buying those just so you don't reinforce that behavior.
And one last question, I think, is giving my teen a glass of wine at a family function, like once or twice a year. Am I promoting alcohol or drug use?
You know, you're definitely not going to get me to say yes or no to this. You know, culturally, you can go to France, you can go to Europe for that matter, and there's a lot of those examples being used. So at the end of the day, it's, I think, going to come down to the family. I think just being informed, right? Alcohol is a psychoactive drug. It does impact the brain. Does it mean we should never consume it? No. How do we do it responsibly, right? What are we going to be looking out for, right? Are we using it to address our mood? And if so, that's a risk factor, right? If we're drinking it to manage stress or to fall asleep or to become happy, we now just went down that slippery slope. Doesn't mean it's an absolute, but we're setting ourselves up for that possibility. So again, I think having that with teens culturally, I totally get it. When it's being modeled, then you're decreasing the likelihood of your own child to use it in a maladaptive way. So it's a personal family choice at that point.
Great, thank you. I'd really like to thank you, Ricky, for all the knowledge and gems that you dropped on us tonight. We're thankful to have clinicians in the community that are willing to take time out and be real and tell the truth. If you're interested in contacting Ricky for additional speaking engagement, you can email us at info@jacobsladdertherapies.com, and I will pass along the information to him. Again, if you missed any part of this or want to recap, you can view it on our Facebook page or YouTube channel, and I put that in all of the chat rooms. These links have already been posted. If you feel like your family member could benefit from therapeutic services, please contact us. We, again, do free assessments daily to help determine the right level of care for your family member, even if it's not with us. I've also put the link to self-schedule, link to self-schedule an assessment in the comment section. And you can also view all of our clinicians on our website at www.jacobsladdertherapies.com. Next week, we will be talking about social media. So Ricky mentioned TikTok. If you don't know what TikTok is, you are going to want to join the session next week because all of your teens are on TikTok. If you thought they were on Facebook, you really need to go up to attend the next session and find out where they actually are, especially now that they're all stuck at home on social media. But thank you again, Ricky, and to all of our viewers on Zoom, on Facebook Live, on YouTube Live. Thank you so much. Have a good night, and please stay safe.
Thank you all.
Thanks. Bye.